Hi, everybody. My name is Lauren Hauk. Thank you so much for joining us today for our special online event on destigmatizing sexual addiction and love addiction. Thank you for taking the time. So happy to have Chrysalis Way speakers here. We have Mindy Barron, Tiffany Anschutz, and so many more. We will have clinicians from Chrysalis Way, a new national online sex and love addiction track and IOP, Mindy Barron of Hope Street in Chrysalis Way and Ignite Teen Treatment, and Eden Eating Disorder Program for Women in Las Vegas, Tiffany Anschutz, again, of Sage Recovery and Villa in Austin, Texas, and hopefully Ken Seeley of Mental Wellness by Ken Seeley, his new mental health and OCD residential program in Palm Springs can join us. He's on a layover. Hopefully we'll be on a layover and can join us. All registrants will receive a $50 discount to Ken Seeley's next CCMI, Certified Case Management and Intervention Training on cultural competencies, September 18th to September 20th. Therapists can just come for the 20 CEs and networking, or any behavioral health professionals can continue and do all 5 trainings to become a certified case manager and interventionist CCMI. I'm so excited to be a part of this online event as I'm just over 4 years in my recovery from sex and love addiction. I've struggled with those issues probably since I was a teenager until my mid-30s or so. Was in two very unhealthy relationships in my 30s that I can tell you nearly killed me. Both men abused alcohol heavily and were very emotionally abusive. I've experienced love addiction withdrawals a few times in my life, and I believe there are many people out there that suffer in silence, a large part due to stigma. Love addiction withdrawal can be deadly, especially if mixed with substance use, for sure. Recovery changed my life dramatically. Now have self-love, and am now and so thankful for my journey. So again, welcome everybody. Make yourselves comfortable. We are at 92 participants now. I think we had just so 300 something register. So this is totally fine. We'll just keep going. Without further ado, I'm gonna go ahead and turn it over to Faith Nees, Program Director of Chrysalis Way.
Thank you so much, Lauren. So first off, welcome everybody who is attending or watching this as a recording in the future. I do want to mention Yankee Greenberger has also joined us. He is a CSAT in Chicago, Illinois. I'm going to have him introduce himself first, and we'll go through all the panelists. So if you guys would introduce yourselves, what your clinical background is, what brought you in, maybe what brought you into the field of sex addiction, and then what are the common stigmas that you see clients dealing with?
All right, hello. Thanks for letting me be here with you guys. So my name is Yankee Greenberger. I'm a licensed clinical social worker in Chicago, Illinois, really right outside in Skokie, Illinois. I've been working in the field of addiction for the last 15 years. I've been blessed to be the clinical director of 2 community organizations, which has done some tremendous work helping, into the thousands of families and individuals. It's a real blessing that I have in my life. I came into the world of sex addiction, I guess by chance. I think one of the issues with sex addiction is people think it's just like drug and alcohol addiction. So being someone who had a reputation of working with drug and alcohol addicts, I would get some referrals of people who are struggling with sex addiction as well. And very quickly I learned that sex addiction, sex and love addiction, is different than drug and alcohol addiction. And I decided to kind of do the CSAT training, get myself further educated. The thing I tell all my clients is that if you ever see a therapist that thinks he knows it all or she knows it all and is not looking to further enhance their training, find a new therapist. So I practiced that and I got myself trained in that, and I focus primarily my private practice now in trauma and addiction work. I think one of just to, I guess, start the conversation of stigmas around sex addiction is that that the person themselves is an inherently evil and a disgusting individual, and I think that comes from not understanding that the addiction aspect of sex addiction is an addiction. You know, in that sense, it's not similar than drugs and alcohol addict, and we don't look at a cocaine addict or a heroin addict as someone who is disgusting and vile and can't control themselves. I think we've gotten to a point in our society where we understand that. So I think one of the first stigmas I find myself breaking with my clients is that they're not disgusting, vile individuals. They are struggling with an addiction. And, once we can normalize their sense of self, we can get the ball moving with, how to live life with recovery, which is different than sobriety. I think recovery is an important piece. Just staying sober is not what recovery is all about. That's something I find to be a huge stigma in this, is that the self blame and shame and the guilt and the self disgust that a lot of people who suffer from sex and love addiction have, and that's probably the first stigma. So I'll turn it over to my colleagues now.
Awesome, thank you so much, Junkie. Gara, do you want to go next?
Hi, I'm Gara. I am a therapist working with Lionhearted and Chrysalis Way. Super excited to be here. I think that Yankee did such a great job at touching on the topic of it being a moral dilemma, right? Rather than sex addiction being an addiction, it actually makes me think about one of my favorite, I'm going to call him a teacher. One of my favorite teachers says, we ask not why the addiction, but why the pain, right? Like breaking through the denial, breaking through that shame and that guilt, and being able to get to the actual human being, right? And like what is having that compassionate view of what is actually going on here, right? And being able to create that recovered life, not just a sober life. So definitely working through that moral dilemma, having compassion, working through that shame. Yeah, definitely. Yeah.
Would you mind speaking a little bit about your journey as a clinician? I'm putting you on the spot.
Awesome. Thanks, Faith. My journey as a clinician, a little bit of chance amongst many other things. I've wanted to be a clinician since I was a little child. This is what I've always wanted to do. I've wanted to be a therapist as far back as I can remember. So a part of me is joking when I say that this chose me, but it really all did happen super intuitively and naturally. Same thing with working with addiction and trauma specifically. Years ago, 10 years ago, I remember getting very curious about what I wanted to specialize in, right? And there was this fear that I had about addiction, right? And all of these stigmas, right? Like recovery is not possible. It's so, like people don't recover, all of these things. Like you don't want to work with that population of people, all those stigmas. And I actually was like so curious about this fear that I felt. And I just dug into that fear and just explored and actually like gathered the data. And in a way, like through exploring that fear with curiosity, I was like, I love this. Like I love being able to work with these people and work through that shame and actually help like walk along this journey with people as they heal trauma or unworthiness or insecurity or whatever might be happening for them. So on one hand, this career and this specialty chose me, and I'm super, super blessed. So thanks.
Awesome. Thank you, Gara. Okay, Steve, a little bit about how you came to be in this field and some of the common stigmas you see in working with sex and love addiction.
Thank you, Faith. My own journey is part of how I got to become a clinician, which I did as a second career. I'm a licensed mental health counselor with a specialty in complex or relational trauma, family dysfunction in Florida. And I learned through my own recovery experiences from alcohol and drugs that there was some other comorbid stuff going on. And after a couple of years of being in recovery and sobriety, I was thinking, is this all there is? You know, and I'm in my 40s at this time, and I realized that something wasn't quite right, and I thought that I needed to look deeper, and I went back to school and learned to become a clinician, which 35 years prior, I had gotten my degree in psychology and meant to do it, but didn't. And 35 years later, I did. And I learned that there was so much more to me, and therefore all the other people like me, that something was missing in typical treatment of virtually everything. We're talking about sex and love addiction here, and I think that falls into the same category. So I sought out ways to learn more about the underlying core issues that affected me, and I went and did the work as a clinician, but client, so that I could understand me better. And it was absolutely transformative. My life changed 180 degrees, stayed sober even through the time when I thought, oh my, this is horrible. I really don't think this is worth it. But when I did this work, I said, I have to do that. So I sought out programs, and Faith and I worked together in one of the better programs that worked on trauma based on the core issues. And frankly, the underlying stuff is what affects the dysfunctional behavior and the self-defeating behavior and the self-loathing that comes along with, you know, how we act out, how we protect ourselves, and in my case, survive until your mid-40s. And I came to the sex addiction component initially through Faith. We talked about it. I listened to her do some trainings for our staff at the company that we worked at. I realized that, you know, I'm seeing this in the news all the time. You know, this person is sex addict, and this person is a sex addict, and this person is a sex addict. And everybody that, you know, is famous, that's performing all of these, you know, horrible things that you're seeing and hearing about in the media are just as sick as me. They just happen to be famous, and they're getting a, you know, a look at how the world looks at people who have sex addiction or any other addiction, with all of the stigma that is associated with it. And I wrote down what Yankee said, inherently evil. You know, the predators that are out there aren't necessarily sex addicts. They're more sick people with power issues that are, you know, not really part of this comorbid stuff that I'm talking about. I thought that the world was getting, and the people in it, unfortunately, a short shrift by being looked at as predatory, when the fact of the matter is they were sick. Sunny here in Florida, obviously. So I went further and I learned as much as I could about the disease of addiction. I've been treating people for 10 years in a variety of capacities, but I started my own practice almost 2 years ago, specializing in trauma. And I find that virtually everybody that comes into my office has some set of these comorbid, dual diagnosed problems, and sex addiction is a big one. And in South Florida, there aren't a giant number of male therapists. So I get a lot of clients that are seeking to be able to, be open with a male client, a male therapist. And I'm super grateful that I, went down the path I did, and wound up here tonight. So thanks.
Thank you, Steve. Yeah, briefly, so my name is Faith Neese. I'm a mental health counselor, marriage and family therapist, and certified sex addiction therapist. I'm in practice in Boca Raton with lighthearted counseling, as well as program director for Chrysalis Way's IOP program, which is a virtual IOP treating sex and love addiction. I got into this field, in my education, what I saw was the way sex and love addiction was approached by my cohort or my other students in my class was as the thing that nobody wanted to work with. And it was what my perspective was like, okay, so this is basically the next frontier in treating addiction, because at one point the alcoholic was not viewed the same way. So I think it was Yankee or Steve, you touched on how we've gotten to a place in our society where there's less stigma or shame or judgment about chemical dependency and substance abuse disorders, and there's been a lot of advocacy for that. And so that's not the same way that an alcoholic was treated 40 years ago. But sex addiction is like that new frontier of like, how do we get the same acceptance and love and support for the clients as we've now gotten to with substance abuse. And even the difficulty with seeing it as a valid addiction. Process addictions are different than substance abuse in general, and they're complex in ways that make it hard to just say abstinence is the answer. And I think that makes it also hard to formulate diagnostic criteria that can blanket diagnose. And so we're at the next edge of how do we treat addiction from this more informed place of what it's actually about. And that's what I really love about everybody that's on our panel, is that the approach isn't about like addiction is all inclusive, is a way to say it. That if you're coming and you're saying that it's a problem for you, then we're going to take that seriously, and that it's not our job to decide whether or not somebody's an addict, but guide them towards their own understanding of what addiction might mean for them and how it's impacting their lives. And I think that can be complex with sex and love addiction, because like our panelists have talked about, it gets mixed in with our morals and values, which sex addiction is not a moral dilemma. Another thing that led me to this path was just the way that it was all encompassing in its recovery. Like when we recover from sex addiction, we're recovering at such a deep level. Our sexuality is very close to our spirituality. And so my approach has always been, it's the deepest form of healing. And there was an article written years ago that I shared in one of my sex addiction groups. And it was about how sex and love addicts in recovery make the best partners, because they're going to be more tuned in. They're going to be more aware of boundaries. They're going to be more considerate of their partner's needs, and they're going to be more expressive about their needs, because the level of recovery that's required for somebody with sex and love addiction is so deep, because it's so intimate and close to who we are as people with our sexuality. So I always think about that anytime I see a client that is like unsure if their identity in recovery is going to make them not attractive to a partner. I think that's one of the stigmas, is like, I'm going to be rejected. People are gonna think there's something wrong with me. The stuff that was mentioned also, or that people are gonna think that I'm a sexual predator. And just the fear of isolation and rejection, which for most humans is a core fear. None of us want to be rejected. And when we start to look at that, addiction there's more to be championed about being in recovery from addiction than to be shamed for having the addiction in the first place. And that idea of like overcoming something gives us a power and an empowerment to live our best lives. And Yankee mentioned this, and me and Shauna talk about this a lot, is that there's a difference between being sober and being in recovery, you know, and that like the life that we get to have and that we want to have, it's this free, loving, beautiful life. And that's what recovery actually grants us, that people who want to be in recovery and are actually having real recovery, it shows on their face. So I know I got off on a little bit of a tangent there, but as far as the difference between sex and love addiction, I just want to address that really quick. It's very common for me as a clinician. I'll accidentally lump them in together, and when I'm meaning both, because in my mind I'm thinking of both, but there is a distinction. Usually sex addiction, but while both can be intimacy disorders, or we're avoiding intimacy by acting on the behavior, the sex addiction is more about the avoidance of intimacy through physical contact, while love addiction is an avoidance of intimacy by being emotionally enmeshed with somebody. So that's the best way I can describe it. And I want to hear for you guys, Yankee, Gara, Steve, if you have like other views on the differences or similarities between sex and love addiction.
Well, I guess I'll say I kind of look at the general scope of sexual addictions, you know, very similar to what you just said, Faith, about it really being an attachment based system, where you know, someone who's a sex addict, they're going to be more anxious about certain things, so that they're avoiding the intimacy of a relationship. They're not looking for the relationship. They're looking just. It's almost like the phrase I heard was almost like a relationship disorder, where they're not looking for the relationship. They're just looking for the end game of that relationship. So their anxiety will hold them from being in a relationship and just look for the end result, or, you know, one of the uniquenesses of intimate relationships. Whereas someone who is a sex and love addict, their attachment style will typically be one of preoccupied, where they're emotionally connected, you know, to a you know, we'll call it an extreme extent, but they're emotionally connected and almost obsessive about the actual relationship, where you know, so they'll find themselves, if they're not in a relationship, needing to be into it, needing to be in another relationship. So the idea of being alone and being confident and comfortable not in a relationship is struggling. That piece, you know, the ability to be comfortable being alone and independent is scary. So for sex and love addicts, the need to be in a relationship is what comes out as primary.
I'm curious, Steve, as far as, because I know that you and I both are educated a lot in like the PM Melody model. While I come from like also with the CSAT background, one of the things that I really enjoy about PM Melody's work is the way that she talks about love addiction. And I wonder if you have any definitions based off of that.
Well, I do. What I was going to say, and thank you for asking, Yankee, again, hit on it. And I like to simplify that, right? I regulate as I being the, you know, all-encompassing I, or we, regulate our emotions through actions, behaviors, right? So to separate the two, sex and love, those two addictions, is I'm regulating my behavior through sexual exploits, some of which are healthy and okay and all right, but some of which are not. And in love addiction, I'm regulating my emotions through the use of obsessing over having a relationship and the relationship itself. I'm in love with love, as opposed to I'm in love with sex. And a window popped up while I was doing that and confused me. So in the PMLity model, we look at relationships in our childhood that affect how we are going to grow up and love people. And that is typically as a result of a unhealthy relationship between a parent and a child. Doesn't matter if it's mother or father, that causes the requirement to act out to get the love that you need. And absolutely, over time, it accumulates and accumulates and becomes this obsession that says, I need to have this love interest or this love object that is going to make me feel whole. And it never does until you become whole. And as a result of becoming whole and in love with yourself, not in a narcissistic way, in love with yourself as who you are, then you can love in a healthy way.
Awesome. Thank you, Steve.
You're welcome.
Very well defined. And I think too, there's a question that just popped up and it caught my eye because I was about love addiction as codependency. This is from Marissa. She was in the chat. So one of the things with codependency that I was educated on a long time ago that I always remind myself of is that at the core of every addictive disorder is codependency. If we're defining codependency as I need something outside of myself to make myself feel okay, right? So the core of any addictive disorder is typically coming from a codependent place. There's also a core of shame or a core of like trauma wounding, but the idea that codependency is separate than love addiction, or somebody's a codependent or somebody's a love addict, I think that one of the things that I'm always mindful of is it's more so for the client to know for themselves, what is the thing that I think I need outside of myself to make myself feel better. And Steve said that at the end where if I'm more dependent on, I need a person, a relationship, attention, and that is the thing that I need outside of myself to make myself feel okay, that's coming more from that love addict. Whereas if I need this pornography, sexual act, intercourse, intensity experience of a sexual behavior, that is the thing outside of myself that I think needs to make me okay, and that both of those are coming from more of that core wounding place.
And just to follow up on that, I always use the phrase, and it's what lurks beneath.
Okay, so then let's get a little bit into some of the stigma. So I wrote down a list as you guys were talking, and one of the things that I wrote in about this webinar is, and the description is that stigma comes from a lack of information, right? So sex addiction and love addiction are extremely misunderstood topics because of some of the convoluted stuff that happens in media, or what we're taught through religious influence, or what we're taught through cultural influence, or like we've all talked about already, that like that moralistic view of sex gets imposed, and then sex addiction and love addiction get lost in some of those stigmas, as well as the stigmas around gender, sex, and how those express each other. So some of the ones that you guys mentioned was the stigma of that it makes me a disgusting person or an evil person, that there's something wrong with me, that I have that I'm scary, I'm a scary person, I might have something wrong with me that makes me unlovable, or that I might be a predator. And I think when we're talking about all those, as I go back through the list, I'm curious for you guys, like what sticks out about the commonalities, or what you guys hear in clients, and what can we do to help maybe educate a little bit about the truth behind sex and love addiction. Not everybody at once. I'll start putting you guys.
And shortly or briefly, yeah, exactly what you're saying is, is very accurate. And what we as a society view as healthy sexual behaviors is, it's ever changing. It's, every woman's choice, every person's choice. And it's not always an addiction. And it is a choice of behavior that, for some reason or another, satisfies you. That's not impeding your life. It's not impeding your ability to function. It's not impeding your relationship with your significant other. And I think some of those things get thrown in to the sex addiction pot, and they shouldn't be, because, one person's choice of sexual behaviors may not be my favorite choice of sexual behaviors, but that doesn't mean they're wrong or inappropriate or make a person bad. It is a choice, and within a healthy, loving environment and relationship, or set of relationships even, that kind of behavior needs to be more normalized in what we're seeing today in society. And as we know, we're seeing a lot of media and press that's demonizing everything that has to do with sex, sexual orientation, sexual style, sexual behaviors, none of which need to be demonized. They need to be looked at, be compassionate about, and treated. But lumping all of this stuff together is causing this fracture in how the world is looking at it. And it confuses people, and people who come to me who are diagnosing themselves with some kind of sexual disorder are terrified because of what the media is saying. And normalizing it for them is my job, assuming normalizing is possible based on the presentation. But it makes them feel so much more at ease when you can somewhat normalize that behavior as okay. And no, it doesn't make you bad. It doesn't make you sick. It's a choice. And let's take a look at how that choice is affecting you, your life, your family, the people around you, your job. And does it fit within, your moral structure? And if so, you haven't really got a problem. Just don't share it with people who are going to judge you.
And if I can take what Steve said, and I'm glad that he stole a little bit of my thunder because I've been stealing his. So it's just to take what you were saying, Steve, and kind of taking it, to the other road, if you will, is that not every sexual activity or behavior or action means that you're a sex addict. And I think this is something that I know in the religious circles, is something that comes up often. Is we know that or we're told, and what's interesting is when I went through my CSAT training, I thought that this idea that I'm about to share with you was just a Jewish idea, and then I heard from my Catholic and Protestant and Lutheran and Mormon colleagues that this is a lot of what they've been hearing also. So is that masturbation is a sin, and you're not allowed to do it, and you can't be involved with it. You know, watching pornography is a sin. You have to stay away from it. So I'm not going to get into the technicalities of that, because that's what your religious leaders are for. But I'll say it's just because a person masturbates, and just because a person watches porn, that doesn't mean that you are a sex addict. You know, I have, and I'm sure my colleagues here can identify. I've had clients who come in and say, you know, I want to look at women. I want to look at men. You know, in lustful ways. You know, that doesn't mean anything other than you have a sexual orientation. You know, so there's a piece of that that's actually, you know, normal. You know, so I think one of the things that gets confused is when people are impacted by their religious systems, their religious belief systems, which, you know, I'm an Orthodox Jew. I'm not Orthodox Jewish because, you know, because it's just the way I am. It's a decision that I'm making to be an Orthodox Jew. You know, so I have my beliefs. I have my behaviors. You know, you know, and I'll talk for myself. I don't have problems in self-disclosure. You know, am I a perfect individual and human being? No. You know, I saw one of the questions is there appropriate level of shame? And I think that, you know, there is an appropriate level of shame, and I apologize if I got the question not accurate. I'm not looking at it right now, but yeah, I mean, you know, there are certain things that we do because we don't do because it's going to cause us shame, and that allows us to stay in check with, you know, a moral and value system that we want to be a part of. It's when that shame is a part of this despair, which the only way to soothe that despair is by acting out again. That's when the shame and the guilt needs to be focused on, and that's when a lot of the negative beliefs about ourselves kind of infiltrates, because you know, we are categorizing ourselves as something innately negative, and we're not. We're humans who do well, and we're humans that struggle. So you know, I just want to also, so that's what I'm picking up of what Steve was saying, and then I'm going to be quiet. Is you know, just because we have sexual desires, and because we sometimes will act on those sexual desires, doesn't mean that you're a sex addict. Doesn't mean that you have a sexual a problematic sexual behavior. It could just mean that you are human, and that's okay. You can be human. Thanks for letting me share.
Garrett, do you want to jump in on this at all before I run off onto the next?
I love how much has been shared. I'm just taking little pieces from everyone. I love that Yankee brought up like the topic of attachment, right? And before, I think it was you, Faith, who brought up the topic of codependency. I was like thinking about attachment trauma and attachment wounding, and how that's connected to like intimacy avoidance. And it really, what that does is that kind of makes me begin to get very curious about, you know, like what could be getting in the way of somebody connecting in a like healthy way. And that really opens up the door to, you know, like creating that recovered life and healthy relationships. I just kind of wanted to share little pieces that I really appreciated, like the topics of attachment style and attachment wounding, and how that's connected with like PMLD and codependency, and just like being present with those topics and how they can really be invitations for like healing, right? And like little clues as to what directions we can go in for that healing. But I love everything that's being shared so far. Thanks.
One of the things also that I think, like, one of the stigmas is the idea, like, when I was going through that list, it's like all of the ways that we moralize addiction, love addiction and sex addiction, it takes away the fact that recovery is possible. If it's just that there's something wrong with me as a person, it means there's no hope, right? And whereas if I'm able to seek a professional and have the guidance that, like, this is a behavior, and ultimately once you're not acting on the addiction, you have a choice, and each moment is a choice. It takes away from being a hopeless, there's just something fundamentally flawed about me as a person, and puts it into an empowered place of, like, how am I making choices that are in line with my authentic true self, or my values, or my morals that are important to me and that I've defined. Rather than, and I always use the analogy of, like, if I'm driving a bus, right? Is my addiction driving the bus, or I'm like sitting in the back of the bus making trouble? Like, am I ignoring, like, and not, like, driving my own choices, behaviors, and actions? Or am I in the driver's seat, and, like, my addict might be hanging out in the back of the bus making problems, and all the other things that are parts of me might be in the bus with me, but ultimately my healthy adult or my true self is the one in the driver's seat. And when we have that level of, like, making a choice about our behaviors, then we can have freedom from that act of addiction. The hard thing is that if I never feel safe enough to go explore what are the behaviors that make me an addict, or what are the behaviors that don't, then I won't know whether or not it's me in the driver's seat, or it's my love addiction, or my sex addiction, or my whatever it is, gaming, gambling, anything. So I just, like, I like it when a client has that moment of realizing that it's not hopeless for them, that there's not something fundamentally flawed about their ability to get better. And another stigma that I was thinking about that we hadn't really touched on much yet that I think is interesting is the idea that, like, only women are love addicts and no women are sex addicts, and only men are sex addicts and no men are love addicts. Where, like, really this, like, the disease of addiction doesn't discriminate based off of race, gender, age, religion. Like, everybody is fair game when it comes to addiction, because it's a coping mechanism that is being used in an unhealthy way, or that we've taken to an extreme because we didn't have another way to survive. And all of us as human, like, it's a very human condition to want to seek to survive. So how do you guys see that? Do you guys see that showing up with clients where, like, you get a male identifying client or female identifying client who's like, oh no, that can't be what I am, because it's, like, not masculine or not feminine, or it's perceived as weak to be a love addict, or it's perceived as, like, what I hear from my female clients, it's like slutty if they're a sex addict. And how do you guys deal with that if it shows up?
In the end, and I was noticing, I got distracted a little. I was noticing there's a bunch of questions that are popping up, and
we will make time after. We'll have a little break here in a few minutes, and we'll address, like, that way the panelists, like, all of us have time to go through the questions. So don't worry, we will get to them. But yeah, I was getting distracted earlier too, reading up. There's some really good ones.
Yeah, when you allow external influences to help define how you think about yourself, which is, I think, what you're talking about, and you're not, treated and in recovery and free from some of the shame and the guilt that you've lived with, it hurts. People feel the impact of what other people's ill-informed judgments might be. And just like with any other client in any other circumstances, it's about getting that person to understand that, it does not come from outside. It comes from in here, in here. And if you're loving yourself and becoming comfortable with yourself along the recovery journey, what other people may think if you share with them what your problem is shouldn't have the same impact as time goes on.
Yeah, I think it's like the more comfortable I see a client get with their addiction, the less of a negative impact other people's opinions are allowed to have on them. And I know that's for me personally too. Like the more comfortable I am owning my story, the less other people can hold it against me. And unfortunately, that is some of the things that I see that I'm working on with clients, is how to be resilient to the times where only pieces of their story are then held and told as the whole truth about them. And that's not accurate. And I think that's also another thing that can be a stigma about sex and love addiction, is like, that's who the person is. It's like a giant label stuck on the shirt, and that's only a small portion of who the person is. It's a reflection of some choices. And while addiction is completely all encompassing when we're in active addiction, it's not defining to who we are as people once we're in recovery. I become defined then by my recovery choices rather than my addiction.
Yeah, I would say also is that, I think some of the gender roles that take place with this is similar to eating disorders, where the thought of a man having an eating disorder is not possible, and the man wanting to be in a relationship for to need that relationship, and not as interested in sex as as they are in the relationship. I think that certainly comes up a lot. I've worked with a lot of men who have binged and purged, and I've worked with a lot of men who who value the relationship more than sex. And so I think that there's the gender roles with addiction, but in general relationships, in terms of the in terms of how people view relationships in general. But with this webinar being focused on sex and love addiction, is the fact that the idea of a man, desiring relationships and needing to be in relationships, can feel very, either demasculating, or they feel less than, or they come in not knowing, but not exactly even understanding that is a love addiction, because men don't have love addiction. Men just want sex, and I think there's a lot of confusion with people that come in, with that, with those presenting problems, and the education that goes in, that men can have eating disorders and men can have love disorders. And I think that's something that comes up more often than I think people realize.
Yeah, I think similar, but on the flip side of the gender spectrum, like the amount of female sex addicts specifically that are presenting more so with sexual addiction is very underrated, and we're underinformed really about what's going on for women. And I know personally as a woman, there is a social pressure to be a certain type of way to be acceptable, and if I was acting out on an addiction, I'm already riddled with such shame that then that social pressure would make it very difficult for me to want to seek treatment for it, because how am I going to be perceived? How am I going to be looked at? And like, it's almost like the shame makes it feel like everybody's going to see, for lack of a better way of saying it, everybody's going to see me naked. you know, like with the minute I acknowledge that I'm in recovery for sex and love addiction, and am I putting out there my entire history for everybody to judge and assess. And the reality is like what we're showing when we disclose or when we come to a therapist for treatment is that's a healthy vulnerability, as long as you're with the right type of therapist, you know, like who has background in treating this. They're going to understand that like there's a healthy vulnerability in that first time ever acknowledging that like maybe I am a sex and love addict, and for a woman to acknowledge that maybe this is a sex addiction, what comes up with that is so much pain and stigma of then am I going to be perceived in this unacceptable way. So I think that because of that, and this has been researched before, but there's a lot of underreporting for women and lack of seeking services for women with sex addiction specifically, or they'll channel it into I'm a love addict, but I don't want to acknowledge that it's a sex addiction issue, and so then they might get mistreated depending on where they're going, and then that sexual addiction continues to progress. And like I said earlier, it doesn't discriminate. The behaviors might look different. Love addiction might be more of the obsessive or fantasizing or fawning type of behaviors, whereas sex addiction might be more of the overt sexual acting out or pornography or being exposing, and that the behaviors are different, but at the end of the day, the pain is the same. And that brings up another thing that Lauren mentioned at the beginning of the webinar, that like the amount of rates of suicide or deaths related to sexual addiction and love addiction is also, I think, one of the things that's not always addressed or talked about, like, because we're not as aware. It's so easy. It's like, I think it was today, is it today or it was yesterday? My days are blurring together. It was Overdose Awareness Day. And like for substance abuse disorders, like we're so aware that like an overdose occurred, but for a sex and love addict who hasn't sought treatment, the possibility of suicide or an overdose that's from a substance abuse disorder, we're not seeing that it's actually an untreated sex and love addiction. And that, I think, is something in our profession that we have a duty to be aware of, the true risk of addiction, which is death. I didn't leave an open-ended question, so if anybody wants to jump in on that, we have a couple more minutes, and then we're going to have a break and have a couple of the sponsors share some information.
So I just want to take a moment to honor like the difficulties that so many people that I work with, whether they are struggling with sex addiction or not, it can be very difficult for people to talk about sex in general. So I just kind of wanted to like bring that up, because if we are feeling so uncomfortable and so avoidant about talking about sex and sex education, imagine how difficult it is to talk about struggling with the possibility of sex addiction or even love addiction, right? So I just wanted to take a moment to honor like anyone who feels uncomfortable even saying the word sex or having a conversation about sex, or even being willing to explore what they were taught about sex, about, you know, their body and their relationship with sex. So, and I also, like, I heard a lot of shoulds, right? Like I'm a woman, so I should be struggling with this one, or I'm a man, I shouldn't be, or whatever. That may be a lot of should, right? Like, and how that really opens the door for us to explore our own beliefs, right? I'm wondering, whenever I hear shoulds, I'm like, says who, right? Like, and you know, and like I always get curious, like, well, what are your beliefs about this? Like, what, and exploring that. So I just wanted to take a moment to honor the information that comes from exploring the shoulds, and how difficult it can be for so many people to even just talk about sex in general.
Awesome. Thank you, guys. So I know we were going to have Mendy speak a little bit about his program. So oh, good. Yeah,
I was here, but I know how hard it is to get a vibe started with a panel. So I didn't want to be the one silent, staring person in the room. My name is Mendy. I don't have much to say here because one of the big things that I believe in is competencies and core competencies. And this is not one of my core competencies. I am a clinician. My competency has shifted from working on an individual and family basis to working on a systems basis. I've had the blessing and opportunity to create some really wonderful treatment centers, not wonderful because of what I created, but because of the people we brought together. And when I think about competencies and I think about specialties, and I think I'm an Orthodox Jewish kid who's used to listening to rabbis preach, and it is the high holidays coming up. I'm always reminded of the story of the guy who's sitting in he's sitting in the river and he's drowning and he says, "God, save me." And someone pulls up with a canoe and he says, no, I got it. God's going to take care of it. The canoe guy paddles his way away, and then a motorboat comes by and he waves him off in the same way. And a helicopter comes by, and unfortunately the gentleman passes and he gets up to heaven and he turns to God and he says, "Hey, what gives? I asked for help and you didn't show up." And God says, "Well, I sent you a canoe and a boat and a helicopter." And so to me, as a provider and as a father whose kids are sneaking out of their bed, I like to create an environment where we provide as many methods as possible for people struggling with different disorders so that we can be the canoe and the helicopter and the boat, that we can do it competently, that we can address different issues from sex addiction to chemical dependency to mental health to eating disorder programs to teen specific programs. And the beautiful thing about what we're offering with the sex addiction track is that it's unique. It involves people whose core competency is this. It is culturally sensitive. And it's part of an overall network through Hope Street where we offer different tracks as well. We have grief and bereavement. We're working on eating disorder. We have a mental health. We have a women's, a men's, a teen. We've really tried to create as many situations as possible where if you need help, we can provide help, that we are the hope, that you can find hope. And that was the common thread through everything I've heard so far, is that the most important part of healing is believing that healing is possible and that hope is possible. And so I'm just honored to be here and to be a fly on the wall. Thank you for having me.
Thank you, Cindy. It's a pleasure. And then I know, Shauna, did you want to say anything more specific about Chrysalis Way, or did Mendy cover it? I was busy with the Q&A.
Sure, I'll jump in real quick. Hi everyone, I'm Shauna. And I just wanted to share a little bit about how this program came to be. Ellie Nash, I don't know if any of you are familiar with him, but he did a webinar on porn addiction. The topic was exit strategy. Go check it out on YouTube. It was phenomenal. That was about a couple of months ago, and Faith was one of the panelists. And I helped him put it together. And afterwards, there was just an enormous amount of people reaching out saying, "I need help. Where do I go? Tell me, please help me. I think I'm a porn addict. I might be. I don't know where to go. I'm going to the 12 steps rooms. That's not working. I'm with a therapist. That's not working. What can we do?" And we started looking around to see which therapist has the space to take on additional clients. And what we found is that the people that were really good just didn't have the time. So we're sitting there where we opened up everyone's awareness on addiction, and we can't help them. And that's when I said, we need to help these people, because I know that feeling of being helpless and hopeless, and that's not what we're going to do. We're not going to end here and just say, "Sorry, you could read some books, but we don't really know what else to do." And that was when I actually approached Mendy and Faith, and I said, "Hey, let's pull this together. Let's make this a program." And when I did reach out to Faith, she said, "Absolutely, but I just want to make it very clear. There's two ways we could do this. We could do this cheaply, and if so, I'm out. Or we could come and make this the best sexual addiction program out there, and if that's the case, I'm in with both feet." And that's really what we've been doing. We spent the last couple of months putting together this program, just trying to make it all inclusive to be able to help everyone, whether you're struggling with sex addiction or love addiction or anorexia of sexual love components. Let's help the people that don't know where to turn. And we've all been there. We've all been at some point in our life where we've struggled, and it's okay to struggle, but let's all get through it together. So that's really how this came about. I just wanted to share a little bit about why we're doing this. I thought this webinar would be a great way just to bring some light into this. I know this is not something that's normally spoken about in such a forum, so I welcome it, and I hope we can go far places with this. Thank you.
Awesome, Shauna. Thank you. And yeah, I'm really, really honored to get to be a part of this. I wanted to say, we also have Tiffany from Sage Recovery. I was gonna have her speak a little bit about her program. She was generous enough to help sponsor us and be part of this with us. And they are in line with what we're doing at Chrysalis Way. And so we thought that they would be a great supporter for what we're working on. So Tiffany, whenever you're ready.
Yeah, hi, thank you. I'm a clinician as well. And while sex and love addiction is not my specialty, I do have staff that work for me that is their passion in their area. And when I opened Sage Recovery, similar to what had been discussed before, was, you know, that the co-occurring disorders that go along with mental health, you know, substance use, other process addictions and things like that. And I remember not that long ago, it used to be a separation, you know, this idea of, you know, we have to treat addiction first before we can treat the mental health, or we need to treat the mental health before we can treat the addiction. And as a clinician, that was a little frustrating. And so when I opened Sage Recovery about 6 years ago, my outpatient facility really addresses the whole family. So from play therapy all the way up to, you know, PHP and couples and family counseling and yoga and acupuncture and things like that. And because I strongly believe you need to be able to address the mental health, the process addictions, the you know, substance use and all of that, as well as the family all together. Or maybe some people just need some individual work. I opened up Sage Recovery Villa, and similar thing, you know, it would be, okay, we're addressing the addiction, we're addressing the mental health, we're addressing the trauma, but, you know, there's also a whole lot of guilt and shame that comes around, you know, either the sex and love addiction or even just sexual behaviors that occur in their addiction. And until you begin to address some of those things, they continue to kind of feel like, am I alone in this? Do I feel different? You know, I do. And, you know, nobody else is talking about it. I don't know how to bring that up with my clinician. And so I strongly feel, you know, to be able to have those open conversations and help reduce the shame and help people work through that is essential. Yeah, so we're happy to sponsor. We're glad to do that. We are able to offer some, you know, CE certificates. Just, I know there's people from all over the country, and obviously we're not licensed with everybody, but reach out to Lauren if you have any questions regarding that. We're happy to send that out. And then, yeah, so I think Lauren wanted me to show a quick video here, just a quick tour of our facility for just a moment here. 1 second. I apologize. I am not a big I'm not a big Zoom person here, so.
No, take your time.
So thank you guys. But definitely, like I said, please reach out to Lauren if you guys have any questions regarding continuing education certificates for this event.
Thank you so much, Tiffany. And we will have Ken Seeley joining a little bit later to discuss his new program that is also in line with our treatment philosophies and some of our values around treating sex and love addiction. So when he pops on, I will interrupt. So I went through and during this time went through some of the Q&A. I wanted to see first from our panelists if you guys did go through, if anything stuck out. If not, I can start to go through what I'm seeing, like the common questions. I'll go through the common thing. One of the ones that I think covers a question that I saw several times from a couple different people is the idea of what are or how do we look at diagnosing or identifying sex and love addiction? What are the behaviors or what are the symptomology that we're looking for in that? As well as what are common comorbid either personality diagnoses or other types of diagnoses? Is there common substance abuse stuff that we see? Some of the comorbidity that we might see going on. That was a couple different questions address those things. So what do you guys see as far as some of the diagnostic stuff for sex and love addiction? I don't want to run the whole thing. That's why
I will jump in as necessary. Virtually,
I could talk about all of it, but then I would feel really bad that I asked all of you to take the time to be here.
well, then we would owe you. Commonly, I'm seeing males for sex addiction and love addiction, and the love addiction people, there's a lot less, diagnosable comorbid things like substance abuse and stuff. But the sex addiction component, I find there is a substance use disorder, a pretty high percentage of the time. And it could be that I'm in South Florida, which brings everybody from around the country with substance use problems who find out once they've started working on their substance use problems that they have the comorbid love addiction or sex addiction thing. But that's a big one. And, community by community, you're going to see different variants of what those substances are. And to go back to one other thing, and Faith, you and I both know this, working in a trauma environment where you're looking at core issues and stuff, I have never before seen so many disordered eating people with the comorbid sexual addiction or love addiction as I saw during the almost 5 years I was with the last organization that we both worked with. And so one of the questions I did see was, is eating disorder, all women, or heard it somewhere. And the answer is, oh, no. Virtually every single one of the clients I work with that has either a substance use disorder or a sexual addiction, or something similar, gambling, has some kind of disordered eating hanging around there.
Yeah, I was educated that, you might have a client come in who identifies as having a drug addiction or a sex addiction or an eating disorder, or eating disorders are obviously a little bit different than process addictions, but still fall within that treatment range, but a little bit different in complexity. But it's still like that idea that somebody comes in presenting this one thing, it's just that they haven't figured out the other 2 or 3 that are going on at the same time. Like the way we do one thing is the way we do everything. And so if we struggle in boundaries with relationship to money, we may also struggle in boundaries with our relationship to romance or sex or food, and that there is a high comorbidity of addictive disorders or process addictions because it's not about the sex, it's not about the romance, it's not about the relationship. Somebody coming in, I think that's another stigma actually, now that I'm saying it, about sex addiction, is that it's about sex. Sex addiction has very little to do with sex, as you can tell. We've talked about sex today, but not in a way that I think would be expected when you're looking at sex and love addiction. What we're talking about really is that my relationship to how I interact with this thing is dysfunctional because I've used it as a coping tool. And so my relationship with how I use sex might be the same relationship I have with cleaning, who knows, and not to say cleaning. And this is where like the definition of addiction, I think, gets complex, because if it's the way I look at addiction is it's progressive, it's creating problems in my primary relationships, it's interfering with my ability to work, it's I despite desired attempts to stop, I continue to act in the same way, and that way continues to, I need more and more to experience the desired result, the tolerance effect that happens. And so there's a lot of different process addictions that we could look at that fit those diagnostic criteria, and that's how I usually define or I'm able to look at sex and love addiction is do they meet these diagnostic criteria? So the comorbidity is more about like my process of the way I interact with things is wounded, not that I need sex in order to be okay. I use sex to get the illusion that I'm okay. I see you popped on, Gara.
Hey, absolutely. And, speaking a little bit to the difference between like an abstinence and true recovery, I think that definitely comes up with, I look at it through a lens of almost resiliency, right? Like we're actually extraordinarily resilient and we learn how to survive. And you use the word dysfunction, Faith, right? If we're not intentional and we're not intentional about healing any of our core woundings, it's very easy to find something else outside of ourselves to feel okay. And on one hand, I think that speaks volumes for how resilient and resourceful and creative we can be, especially when it comes to our survival. These are things that we've learned in childhood. And Steve actually mentioned, I don't remember your exact words, but it was something about how your addiction may have like saved your life or supported you when you were younger, right? So if we're not intentional about building a life of true recovery, it's very easy to find something else outside of ourselves, even if we're abstinent from our like primary addiction. So just wanted to touch on that.
Yeah, and I think also like with comorbidity with personality disorders, I do see a lot of commonalities both for addicts and people who are in relationship with the addict, the identified addict. There are some common like personality diagnostic things that I see. I'm big on, though, because of my education, because of my background, and I don't know that I was clear or spoke a lot about this, but I've focused in treating addiction from a trauma lens perspective. So that's a lot of times where what I'm looking at, what's going on underneath and where was the pain. And that same for, while there are diagnosable personality disorders, and diagnosis is extremely important for differential treatment, when I hear of narcissistic features or borderline features or dependent features, all of these ways to categorize personality behaviors, my first thought is like all personality issues are just a result of relational trauma. They can all pretty much be tied back to an adaptive behavior. And if we understand why they were valuable in the first place, somebody who is in recovery might be able to actually like heal the relational trauma and not be exhibiting some of the traits of those common disorders that I see. I do see a lot of traits of that, the idea that addicts are self-centered and self-seeking and lack of conscience when they're in active addiction, I think can look like narcissism and can look like antisocial. Or for love addiction, the willingness to self-abandon in order to get attention, approval, or love can look like borderline. But when we get down to the depth of what's really going on behind the behavior, it's not a untreatable personality issue. It's a coping technique that has gone awry.
And if I could just piggyback off of what you were saying, Faith, is that I think that just in my work working with addicts, both drugs and alcohol, sex, gambling, is there's inactive addiction, kind of what you're saying, inactive addiction. They're self-centered, but it's in essence, they're not self-centered for themselves. They're self-centered in getting high, and acting out with their addiction. But with recovery, and I'm sure I've seen a lot of clinicians on here, and all the panelists I'm sure can identify with this, is that in recovery, these self-centered people are the most sensitive people and the most caring people, the most giving people, the most spiritual people, and I think it's that level of sensitivity that, whether you want to say they were born with it or it's a little bit in their, in who they are as a person, when things weren't going well, the ability to tolerate, their window of tolerance, wasn't high enough for them to be able to, kind of conduct themselves with that. So they found a way to be able to live in a world where they're so sensitive to some of the unhealthy stuff that have been going on around them, and caring for themselves. So they use drugs, alcohol, sex, gambling, food to care for themselves. But once they have recovery, they're able to care for themselves on such a high level, and the sincerity of and the genuineness of these people is truly beautiful, and it's very powerful when you see someone go through active addiction and see them through to when they have solid recovery and they're giving back to others. What a transformation that is. But the actuality is that they've always been that sensitive spiritual person. It's just being utilized and sprouted in a way that's healthy. So that's my piece.
I think that's really beautiful, and I'm going to use that actually to segue, because Ken Seeley is here, and as you're talking, I'm thinking about like that coming back to your authentic self, that like addicts are innately sensitive, or they're innately probably more in tune with the world, and that sensitivity can lead to how do I cope with it? And you were talking about like the window of tolerance and that type of stuff. So it just, as you were saying, I was like, this is a perfect segue to Ken, because he's working in the field of like treating some of these sensitivities and helping people come back to that. So Ken, whenever you're ready to speak a little bit more, I'm really excited to hear from you. I hope I'm not putting him on the spot unexpectedly.
There we go. Thank you. Thank you.
I know
good
you're
to see you.
Thank you for making it.
Yeah, thank you. Thank you for having me. I love what you're talking about regarding sex addiction. We have somebody admitting in today with, porn addiction and, as a secondary addiction. And I think one of the most important things that I think is wrapped around with sex addiction, especially with, where I work out of out of interventions, and a sex addiction intervention is completely different than a drug and alcohol intervention. You're not going in there and inviting all the family members. You're not inviting, the grandparents. I mean, there's a whole process around disclosure, and you can't do an intervention around this addiction when there's no disclosure happening yet. That's a process. And so you have to be very, very delicate. And dealing with sex addiction, I mean, I it's one of my favorites that's out there, because people, as you're saying, people don't understand the intensity of sex addiction. And with drugs and alcohol, I see the clients, you know, they're able to numb the pain. With sex addiction, you're not numbing the pain. You're feeling the pain that it's causing on you and the pain that it's causing on family members. So in our trainings, we go over that, when is the appropriate time to invite family members in and what family members in for disclosure. So, thank you.
I love that you're bringing that up, because you also just tied back into other questions that attendants were asking, which is about what is the impact on the family and the pain that can be created. And as a clinician, we have to have a level of sensitivity to, like you were talking about, that formal disclosure process, that typically what we're dealing with is a very fragile family system.
Yeah, no, I just had, you know, the wife calling me and saying, I don't understand. I just left home and my husband said, are you mad at me? Are you mad at me? And she has her phone linked and he's like, no. She's like, no. And then their phones are linked and she's seeing that he's looking at porn. And, you know, it's like she's feeling, why aren't I worthy? What's wrong with me? And he's like, oh, well, ever since you had the baby and you have stretch marks. So she goes, I went and got the surgery to remove the stretch marks and he's still not attracted to me sexually. And so, like you say, it's not about the sex. It's about the disease of the next catch, the disease of, you know, oh, I already have this, but this is even better than what I'm fishing out for and trying to catch. But yet it's not enough because it doesn't give me that high of satisfaction of feeling like I accomplished something or somebody loves me. You know, I'm lovable because I was able to get that one attracted to me. And that's the disease. And this poor woman is wondering, what's wrong with me? You know, I have this kid, we're in love, we live together, but why isn't he attracted to me? And it isn't that he isn't attracted to her. It's all about the sex addiction.
Thank you so much for tying that back in. And I think too, when we're talking about sex addiction impact on families, I think there is also like a large impact on adult children. That's something that I used to see a lot, was the adult children of somebody in recovery from sex and love addiction. They've been exposed to some, like, an intimacy deficit in the family system. And then are wondering, like, why am I having a difficult time, like, feeling with either too needy or not having any wants or needs, or emotionally shut down or not trusting vulnerability. And yeah, it's just like, again, that visible impact on the family with substance abuse, because mom or dad or both are not available due to being high or intoxicated. The family system is silently affected by the sex addiction in a more covert way sometimes. There are overt negative impacts, but a lot of times it goes on the list.
Yeah, it's so true.
Do you mind speaking a little bit about the treatment center that you've been developing?
Yeah, no, we have a treatment center down here in Palm Springs, California, and it's not primary sex addiction, but like I said, we have a client that checked in today, and it's secondary. And the treatment center really focuses on process addictions, because as you're talking about, and I hear other people talking about, it's not about what the substance or the behavior that they're addicted to. It's about the addiction. And the way we treat that is the trauma. There's something internally that's happening with them that they're not connecting the trauma, that they need validation or they need some kind of connection to feel like they are worthy. And that's what I love. I'm going into work today. I'm in San Francisco, flying down to Palm Springs, and doing trauma eggs is one of my favorite part of treatment, because if you could unravel the trauma of what happened between 2 years old, 4 years old, up to 15 years old, the child creates a guard around them to be able to protect themselves. And that I call it a hustle. The hustle creates who we become as an adult. And that hustle doesn't work because it creates harm. And that's really what it is. If we could unravel the trauma, watch the pattern that we created from 4 years old to 15, 16 years old, there's a pattern that we create during that trauma. And if we unravel it and see the trauma that we created, then we're able to see, okay, from 15 years old to 50 years old, or as old as the client is, you're going to watch the same pattern, and you're going to see how those behaviors don't work for them. And that's sex addiction, that's shopping addiction, that's, drug addiction. So whatever it is, you're seeing that pattern. It's just a way that they get to see how that happens to them, because they haven't dealt with that pain. They haven't dealt with that. They still feel like they need someone or something to protect them as a child. So I just love working in this field and working with people dealing with addictions and sex addiction, because that's one that you don't speak about a lot, or it's underneath. And families, like, I was so proud of that wife today calling me and having that conversation with me this morning, because people are embarrassed to talk about this. I mean, it was really hard for her to come out and say, my husband's watching porn and he's not attracted to me. I never met this woman, and she's able to, it took her a while to get there, maybe about 30 minutes of getting warmed up, but she came out and she finally said that. And I think that's really where the problem is that people aren't talking about that. It's underlined, it's there, it's alive, and then they're not treating that. And then what happens, because that part isn't being treated, they go back because now their chemical dependency is, under control, but they're right in full-blown sex addiction because it was never addressed. So we love addressing that at our facility.
And then one final question, then I'll let you off the hook and let you join your flight. But you talked a little bit about like the sensitivity that an interventionist needs to have going into interventions around sex and love addiction. What do you see as the interventionist? Like, what do you think is the biggest crucial role, and how does like CMI teach that to their interventionists?
And that's a great question, because that we go over in the trainings that we do, and that would be in one of the mods, it's process addictions. And we really talk about sex addiction, because if you go in like a regular intervention and invite all the family members and start talking about their addiction, there's always a saying that we've all heard about, that we make our amends unless if it's going to hurt other people. And self-disclosure, if it's not handled properly, talking about the things that they do during their sex addiction, it really hurts. Like this woman this morning saying, why aren't I good enough? And that could create a lot more self-harm for the people around them. And you can't do that. So you have to know who you're inviting, and not only who's going to be a part of the intervention, but then how much are we disclosing through the process? So I always like to do it where there really isn't a disclosure. It's more of a behavioral intervention. There's a behavioral problem that we want to address. And when they get to treatment, let the treatment center work with the family system to figure out how to create that disclosure. I mean, Caroline Smith is one of my mentors. I don't know if any of you know her. She's just amazing. And she's, incredible. And she's really, understands and really helped us through this process during our intervention trainings around sex addiction, because, you could go in there and, open up that can of worms, and things come out that are not, that will hurt other people and create more harm for the client than is necessary if you're not careful on how you approach a sex addiction intervention or bringing that part in of the addiction to the intervention.
Awesome. I really appreciate you, Ken.
Thank you. I appreciate you.
Then I want to turn a few things back onto the panelists. One of the things also that came up in the questions was sort of like how can you have a healthy relationship, either romantic and then also healthy relationships with family? Like if they don't think sex and love addiction is real, or they're not able to validate or because of their own wounding, maybe accept that, like how would you guys handle, like what does healthy recovery and healthy relationships in recovery look like for sex and love addiction?
So if I understand the question correctly, I think one of the things we have to recognize is that for the family members, the spouse, maybe even some of the children, but specifically with the spouse, is the fact that what they're going through is trauma, right? In the field, we call it betrayal trauma. And I think one of the things that is really healthy that's happened over the last number of years is the moving away from, in the world of sex addiction, moving away from this idea of codependency to betrayal trauma. Because, we have to recognize that, sex addiction may not have been, codependency may not have contributed to sex addiction, which in drug and alcohol addiction, sometimes there is, sometimes there isn't. But I think with regard to sex addiction and sex and love addiction, it's not necessarily codependency. It's oftentimes not codependency, but more betrayal trauma. So the spouse, and like I said before, sometimes the children, they really need to get their own support, get themselves in a place where the idea of forgiveness and the idea of quite frankly being consider continuing with the relationship, continuing with the marriage, continue with is something that they can make a grounded decision on, and not come from a place of active trauma, and not come from a place of high intense emotion, but really a sound decision. And I think that comes from a clinician that will be sensitive to the fact that what you're going through is trauma, and will look at it from a trauma perspective and not from a codependency perspective.
Yeah, I think too with the partner and betrayal trauma, one of the things that also I'm seeing in the questions that keeps sticking out to me is the idea of like addiction is boundary violating. Like I'm violating my own boundary system, but what I mean by boundary system is that like I say I'm not going to do something and I can't help it, I step over that line and I do it anyway. And so I can't stay within my own system of boundaries that I've set for myself, and it's boundary violating to others. So in my relationship, I'm violating the boundaries or the agreements or the safety of that relationship. And when those boundaries become violated, there's that betrayal of, I thought it was one way and now it's not. Usually for the partner, it becomes a complete alteration of their reality. And the idea, like in relationships, this question came up, and why I'm addressing it is like, there's a difference between affairs and sex addiction. And there are boundary violations in many romantic relationships that aren't necessarily sex addiction. One of the things that I talk about my clients with those, that if your partner has a problem with something that's going on and you're not willing to understand and get connected and relational with them about why that's a problem for them, and your need to do this behavior violates their boundaries, like that's a problem. If I can't make my relationship of primary importance, then I need to look at either why am I in this relationship, or why can't I make my partner a priority and stop betraying my agreements in the relationship. This is where I think like recovery has a lot to do with integrity. I start to stay within my boundary system, and I respect other people's boundary systems and agreements in relationships. Any other comments on sex and love addiction versus affairs or healthy relationships in recovery? I see you, Gara. I know. I'm pulling you in every time because I know you have good experience with this.
I was just getting excited in my mind about how for so many people coming into recovery, even at super early recovery, can be an introduction to like healthy functional relationships, sometimes for the first time in people's lives, whether that's with a therapist, a sponsor, you know, peers in a program, and how impactful that can be, because some people have no idea what are the characteristics of a healthy relationship. And again, I want to tie it back to like being intentional and working with a therapist about that. And, you know, and then when I think about addiction in general and how that is something that is almost synonymous with like a disconnection, right? A disconnection from ourselves, a disconnection from our present moment experience, a disconnection from another person, right? And like, what is it like to be in relation with another person, and all the fears and the anxieties and whatever might come up, and how beautiful and what an opportunity that is, and all that stuff that can come up just from simply being willing to be in recovery. So you asked for it, Faith.
Well, and I think one of the things too that I think you're really attuned with is being how to both honor the family's wounding, and while still validating that like addiction is not a moral issue with the client, and helping family members navigate that. I've seen you work really well with that, so that's why I put you on the spot.
I wanted to add something along that same line. We're always in this field industry tending toward talking about the identified patient, the one who has the problem, needing to do all this work to create and begin a journey of recovery. I'm an avid believer in parallel journeys that the family needs to take in order for this to work, and that it you know, if you're living in a environment where you're experiencing, as Yankee was talking about earlier, all of this betrayal and this drama, you need to do your own work separate from the work you're doing with your identified betrayer, in order to get to that place where you're capable of hearing the truth, where you're capable of making, informed decisions about your relationship, and where you're ultimately capable of forgiveness or otherwise. And one of the things that, unfortunately, in individual environments like we're in our own private practices, it's very easy to point to a colleague and have the other person do their own work with that other person. But in the treatment world, historically, that work has been left for the other person to figure out on their own, or not do, and focus on the other person's problems, which leaves this codependent gap, or that continued chain operative when that person returns, if they return to their loved ones. I just consider that to be one of the most key components to a successful relationship, if that's the ultimate goal, is separate work, separate ideas that mirror one another, that bring it back together, so that you're capable of having that functional, healthy relationship instead of the one that you had previously.
Yeah, I see an interesting question that I kind of want to attend to, which is, it came up in another question as well, about like people who choose to have non-monogamous relationships, and is that overtly a problem? And I think all of us have, do they really have sex and love addiction, and does it show up for them, and how does it show up? So I want to kind of address that, because we've been talking about this, but maybe not saying it directly. All of us have said it in different little ways, of like that a person's sexuality is their choice, and as long as they're respectful of their partners and the situation, that that is something that everybody has a freedom in their own sexual identity to discover. It's not my job as a clinician to tell you moralistically what is okay or not okay. And open relationships aren't overtly sexually addicted or love addicted, but there are certain things that we have to be mindful of that can happen either within the swinging community or the BDSM community or different fetish communities, or then non-traditional relationships, that sometimes, if we're not careful, it could be coming from that trauma repetition. And in that case, it's very likely that there might be some sex addiction or love addiction components going on. But what we would also see in addition to that is boundary violating behaviors, progression. We would have a client experiencing, needing more and more to experience a desired result, you know? And so it's not just that being in an open relationship all of a sudden makes you a sex and love addict, or having a fetish or having a different sexual orientation or sexual identity makes you wrong or bad or sexually addicted. It's that, does my need for that override the intimacy, respect, love, commitment in the relationships or relationship that I'm having with others, or in the relationship with myself? So I don't know if you guys want to touch on that at all.
Yeah, so you did a great job answering that question. I was looking at that question and knowing that, like, I hope we get to this question because it needs to be answered. I think one of the things that, you know, is obvious, so I'll state the obvious first and then kind of get into the non-obvious, is that you know, people who have open relationships and have a set of rules that they live by, and every part of that relationship keeps to those rules, we don't see those people, right? They don't come to us because there's no problem, right? There's always a problem that when they come to us is when somebody breaks the rules, and there's a repeat of that breaking of rules. So that's when people typically will come into us, and most often they're coming in not because they broke the rules, but because of, you know, a question about, you know, am I a sex addict? Is my partner a sex addict? So that part comes if someone is in a open relationship and they keep to the rules, like Faith eloquently said, have fun. And if there are people that are part of that relationship that are breaking the rules, and it's hurting the other partner, then that becomes problematic.
Yeah, and I think that also, like what you just said, Yankee, like echoes onto that, like the difference between the affair and the sex addiction, right? Is that an affair typically is a one-time breach, or a very limited breach in the relationship. And by limited, I mean not minimizing the pain of the person who has is the partner of somebody who's having an affair, but that an affair experience is typically short-lived. Once discovered, it's either the person ends up leaving or splitting the relationship, or once discovered, it becomes a isolated event. We don't see it as this overarching pattern in this person's intimacy avoidance or relationship addiction or dependency that's going on. We're not seeing other symptoms in the rest of their life. And so the affair is more, and Esther Perel, I think, does a really amazing job talking about affairs and the difference between an affair and a love addiction or sex addiction betrayal, is that it's usually an origin of a one-time stressful event in the marriage. I think it's really difficult for partners, though, to see the difference between, like, is this an affair or is this an addiction? And affairs are usually about, I breached my moral compass. I've done something outside of what I feel morally comfortable with. And addiction is I have to do this because I have no other choice because of the compulsive nature of the behaviors that I'm in. So as a clinician, I usually see a pattern with addiction that's from childhood that's being repeated over and over again, or a pain that's being avoided. Whereas with an affair, it's more of an isolated event rather than a pattern. I mean, we can find patterns, I think all of us can agree, in all of our clients, but the affair isn't necessarily part of an overarching theme. I'm trying to see if there's any other questions that I had written down. One of the things that, it was actually a question very, very early on. There was two things that I wanted to get to. One was around sexual anorexia, and the other was around somebody's arousal template, which arousal template is a CSAT type of model. So I'll briefly describe an arousal template is basically looking at those patterns that I was just talking about. There's an overarching pattern in my addictive behavior that matches with developmental arousal patterns. The question was like, how does that help explain to a partner or family about why I'm an addict? And does that help, like, in my eyes, how does it help destigmatize? Like when we understand the patterns or help our clients understand the patterns, how does it destigmatize it for them? And then how does it help them relate to their family? And what do you guys think about that? Not everyone at once.
I will give a short response to that question. I think that the overall description of how, why, and what the individual is doing, regardless of, statistically calculated arousal templates, is going to do a better job of explaining to a loved one what's going on. And again, it's similarly with disclosure. There has to be an appropriate amount and an appropriate time and an appropriate set of things that happen. And over a long period of time of recovery, the journey completes. And this is going to answer one of the other questions. Again, can two people in recovery from sex addiction ever have a healthy relationship? And the answer is, yeah, if you become healthy. And in recovery, I think you said it earlier, Faith, that they make the best partners.
Yeah, I wholeheartedly believe that one. I think too, one of the things that you were saying is like trusting the process, that there's no, part of the stigma, I think, of love addiction and sex addiction is that I'll always be an addict. And one of my thoughts is like, well, when I have a client come in, like I want to be cured. I don't want to always be identifying as a sex addict. Or I don't want to always identify as a love addict. And the difference between always identifying as an addict and always identifying as a person healing and a person in recovery from an addiction, that this is a process, that it takes time. And part of me is saying that because I know that we didn't answer everything. And so we're all in this process. And as we're coming to the end, if I didn't answer or we didn't address something, or maybe we said something too quickly, please feel free. We did record this. And if you want to play it back, or if you want to reach out to Shauna or Lauren, they can always get you guys answers from us. I'm really, really grateful for everybody who attended. And I kind of want to end just with like, hearing from each of you guys, Yankee, Steve, and Gara, like, what are your hopes for the future of sex and love addiction? Like, what would be your aspirations or hopes for what people would get from watching our webinar today?
What were the last two words you used? You're muted.
Oh, sorry. What would be the hopes that clients would feel, or what the future of treatment with sex and love addiction would be.
I think it's a single word.
Is that what I said?
It's close enough. I think the single best word to describe it is a transformational experience and a journey. That's more than one word. Transformational is the one word I was going to use, but I'll add on that. It's a journey of self-discovery that is second to none. If you're the least bit willing and open-minded, there's absolutely a world of hope available.
Thank you, Steve.
I'm gonna, I guess, maybe bring it full circle. I'm not sure, but Steve used the word transformational. I'll use one word: community, and that's you know, if you are struggling with sex addiction, know that you're not alone. There, like what Steve said, there is hope, and there are people that want to be of service to you from a clinical perspective and from a service perspective. You know, the old saying is, you're as sick as your secrets. So join the community.
Thank you, Anki.
I want to thank everybody here on the panel and also everybody who is watching and tuned in. And I want to just take a moment to recognize how incredible it is that you're all here and how much courage it takes to just simply be tuning in. I love everything that's being shared. I love that we all brought something a little bit different. I'm going to second on the "you're not alone" part. You know, we're all just human beings doing the best the best that we can, and recovery is possible. You know, and I think that there's people on this panel who are living proof of that. And lastly, which is an extra plus, I've seen people heal and people grow in ways that they may never would have grown and healed as a result of getting help for an addiction. And I've seen people become their most authentic self as a result of that. And I'm so excited that everybody is here. Thank you.
Thanks, Kara. And it's funny, one of the question just flashed through of how do you define success with a client, and how do you have patients achieve it? And to me, when I'm thinking about what do I want my client to feel, or what are my hopes for the future of sex addiction treatment, is that success isn't defined by perfection or an external definition, or that it's a self definition of feeling like I'm safe and able to have a healthy relationship with myself, which would be vulnerable, open, trusting, and then I'm able to have that with others. And success isn't defined off of having perfect recovery or being the perfect, whatever that is, human, or managing and meeting everybody's expectations of me and making sure that my image looks just we being free from the rat race that addiction can create, and success being that place of genuine acceptance of our humanity and ourselves, so that we can accept others. And I think that goes along with what everybody was saying, the transformation, the community, the healing that can happen. So I'm also hoping that this is a continued discussion, that we become more comfortable talking about sex addiction and talking about love addiction and practicing compassionate acceptance of those in our lives who might be struggling with that. I would love to see it as talked about and as accepted as substance abuse. Even though substance abuse still has its ways to go, I would love to see sex and love addiction in the same vein. So, Lauren, do you want to wrap us up?
Yeah. Well, thank you everybody for joining us tonight. Gara, I was saying you go girl while you were talking with what you said, that hit home, that you know, well, it can be a lot of pain, sometimes for years and years. But when you get on the other side to recovery, it's like, oh, okay, that's why that happened, you know. And you really do become your true, authentic self and really start living and thriving, not just surviving in life. So thank you all for coming. And I'm sure we're going to be doing these webinars probably monthly, maybe every other month. From now on, we will be able to offer probably 3 CEs for each webinar. We did record the webinar, so we can send that out for people that, you know, missed parts of it or whatnot. And then one more thing, for all attendees, you'll receive an email from me with $50 discount for Ken's next CCMI training in September. And therapists can just come for the 20 CEs, or if you're a professional that just wants to continue and do all 5 of the trainings, we'd love to have you do that, and then you can become CCMI certified. And I love Ken's trainings because they focus on, you know, not just substance use disorder, but they focus also on sex and love addiction, all process addictions, primary mental health, and it's they're pretty life-changing personally and professionally. So again, I look forward to Ken. I see you with your super awesome mask on. But again, thank you to all the speakers, Blown Away, Chrysalis Way speakers. Y'all are phenomenal. Nice to meet you via virtual. I think that's about it, guys. Y'all have a good night, okay?
Thank you so much, Lauren. Thank you, young.
All right, take care.
Thank you, Gara. Thank you, Shauna. Thank you, Ken and Tiffany, and everybody else who attended.
Thank you. Have a good night, everyone.
Thank you all so much.
Good night.
Good night, everyone.